This is the Thom Hartmann Program.
Welcome back to the second hour of our program. As I mentioned in the first hour, you're not free if you're sick and you can't get health care. Part of the Democratic Party's freedom agenda should be health care for all. And as I pointed out on this program many times, Canada got Medicare for all as a result of one province, Saskatchewan. Tommy Douglas, the premier of that province, saying, we're going to do it. And they did it. And then everybody else in Canada said, whoa, that's cool. You save money. Everybody gets covered. That's great. Let's do that. And it's spread across Canada. Well, if we could do that in a big state in the United States, like, say, California, can you imagine? Well, they're working on it. Erika Feresten is with us. She is the director of Healthcare for All, the Los Angeles chapter. That's HCALA, or HCA, let's say, as in Healthcare for All, HCALA.org. Also, the national or the statewide organization is healthcareforall.org. Erika, welcome to the program. I understand that back in 2017, I remember when California was like on the verge of passing single-payer health care, and one person, your Speaker of the Assembly, your equivalent of the Speaker of the House, blew it up after taking some major contributions from big insurance companies. Correct me if I'm wrong in that memory, and where are you at right now with this? And do you think you'll be able to overcome that same kind of, so-called corporate Democrat objection?
Well, thank you, Tom, for having me on and helping to spread the word about this seventh attempt to get single-payer passed in California with AB 1400. You are absolutely correct. That bill was Senate Bill 562. It had passed the state Senate, and then Anthony Rendon, who was the Speaker of the Assembly, who's still the Speaker of the Assembly, he had taken a bunch of money from the medical industrial complex and killed the bill. But yeah, so you are correct in that. But we got right back up, and by we, I mean the California Nurses Association is leading the charge again with this bill, Assembly Bill 1400, the Guaranteed Health Care for All Act, affectionately known as CalCare. And we're super excited about this bill. This is the state-level version of Medicare for All. It would guarantee comprehensive, high-quality health care to every California resident, regardless of age, race, sex, gender ID, immigration status, employment status, marital status, you name it, income level, doesn't matter. Every California would receive health care as a human right, and it would lead the nation in the greater fight for healthcare justice.
I'm assuming this is not socialized medicine like they have in the United Kingdom, where the government owns the hospitals and employs the doctors, but rather is single-payer health care like pretty much every other developed country in the world has, like Canada has, among others. And that's, basically the state of California becomes the single payer. Is that correct?
That is absolutely correct. Care would continue to be privately delivered as it is now, but it would be paid for through a single public program rather than the fragmented patchwork system we have now. Private insurance companies in California would no longer exist, and this would result in huge cost savings for individuals, businesses, local government, the state government, and guarantee high-quality health care for every California resident. So that's right. You got it exactly right.
So for people who live in California, or people who are anywhere in the country and are going to become activists and try to make their state, follow your lead, with regard to CalCare, this program that you're promoting, what would be the deductibles? What would it cost people every month? What does it look like? How does it work? Do you have to does the state determine what doctor you can go to? I mean, or how play it out for me as a, in the example of, if you needed health care, what do you do? What does it cost? Where do you go? How do you handle it?
So, like I stated earlier, everybody is covered, and there would be no upfront fees. So, no deductibles, no co-pays, no out-of-network costs, no cost. You would get a card, probably like they have in France or similar to your insurance card, and you would go to any doctor in any area that you need. So it's free at the point of service. You would get a CalCare card. and you're free to choose your provider. You don't like your provider, go to another one. No more insurance companies delaying and denying our health care and interfering between us as the patients and our doctors.
Yeah, I'm already seeing, somebody posted on my Twitter feed this morning some new study from some right-wing think tank about how in Canada it takes 7 weeks to see a specialist. By the way, I just tried to make an appointment with a specialist. It took 2.5 months, but nonetheless, the war is beginning. What are the contours of the war in California? How has the health insurance? I mean, this is a multi-billion-dollar industry you're challenging, and you're the 6th largest economy in the world. How are they trying to take you on? And do you think that they'll be successful in again bribing Anthony Rendon, your Speaker of the Assembly?
So, right, the war has begun before we had the bill. The war is always on. It's not just Anthony Rendon that's taking money. It's, you can look at our governors taking money. Pretty much every member of our California legislature has taken money. The author of the bill, Ash Kara and Alex Lee, they're the only 2 members of the California legislature I know of who haven't taken any corporate money. So if you want to look at it that way, yes, we're outspent. And this is why it's going to take people power. And Tom, we've seen this. We've seen this in Barbados. We've seen this in Honduras. We've seen it in our own country. When we fight, we win. And people power can win this. But we need millions of Californians to stand up and to demand that the legislature pass this bill.
Yeah, I'm completely with you. And so for people who want to either A, learn more about this so they can try it in their own state, or B, support your efforts in California, what should they do?
So we have several efforts. If you live in California, we have a pre-written letter that we would like you to send your assembly member. And we have January 8th, the California Nurses Association is holding a CalCare Day of Action. It's statewide. And if you're in California or outside of California, you can join CNA, the California Nurses Association sponsored phone banks, postcard writing, and to find all this information, go to our toolkit, which is a bit.ly address, all lowercase, bit.ly/HCALA toolkit. Again, that's bit.ly, HCALA toolkit.
Okay, or hcla.org, right? We'll get you to the starting point where you can go from there.
Yes.
Erika Feresten. Eric, thanks so much for dropping by. And Erika, excuse me. And good luck. I wish you the very best on this. This could be a turning point for the whole country if you guys are successful. Thank you.
Thank you.
My pleasure. Great to have you on the program.